Hey guys, sorry, I'm going to quickly review the cardiovascular system week 1 anatomy. So the natural pacemaker of the heart is called the SA node, the sinoatrial node. It beats between 60 to 100 times per minute. Everything under 60 and everything above 60 is pathological. 60 to 100 cycles per minute. What is a cardiac cycle? There is a complete contraction, there is a complete relaxation. Now, you do need to know that extremely well trained individuals do not fall under this category. They have a slower heartbeat. So, how does an electrical impulse move from the SA node to the ventricles, the muscles of the heart? It goes from the SA node to the AV node to the AV bundle to bundle branches and the Purkinje fibers. You got to memorize it. Now, once again, a condition of having an abnormally slow, Latin bratus for slow heartbeat is called bradycardia, slow heartbeat. How do you remember it? Tom Brady. He's a very well-trained individual, bradycardia. So, who who feeds the SA node with blood and oxygen? The right coronary artery. It brings blood and nutrients to the SA node. Actually, also the AV node, the second one in line here is this number 2, and this is number 1. And any damage or a block to the right coronary artery, the RCA, may result in bradycardia. And alternatively, you do need to know the term tachycardia, tachometer. Tachy means fast. Sphygmomanometer. So point number 2, sphygmomanometer is an equipment that measures your arterial. It's not venous, it's arterial blood pressure. And the highest pressure against the arterial wall, that's your systolic arterial wall. And you get it when the ventricles contract. I'll show you in class the details. So you do need to understand that a technical term for the relaxation of the heart is called diastole. Technical term for contraction is called systole, right? So diastolic blood pressure is obviously the lowest because heart is relaxing, and so the pressure against the arterial wall is lower. Now, obviously, most of the heart wall is made up of muscle, myo, heart, myocardium. Endo is inside, endocardium is inside. It's in direct contact with blood, and peri means around. So pericardium is the membrane that is outside. Now, the part of the pericardium that directly envelopes the myocardium is called epicardium. Epicardium is a part of the pericardium, and there are 2 parts to the pericardium with fluid flowing in between. So the one, and I'll go into details in class. Pericardial space is where this fluid is, and pericardial space is between the visceral and the parietal pericardium. Know the term pericarditis. Anything itis is an inflammation, acute inflammation. Acute inflammation of the pericardium results in shortness of breath and chest pain because pericardium is very closely linked to the pleura that surrounds the lung, and chest pain. All right, so any person who lies down stretches this pericardium even more. Pain is increased. Patient also feels more pain with deep breathing. Myocarditis, inflammation of the heart muscle. Do not confuse it with pericarditis. Those two may run at different times. You may have myocarditis without pericardial inflammation. So, rooms of the heart, the atria, ventricles, right atrium, right ventricles, are called the chambers, and they're separated by a wall that we call septum, plural septa, septae. And these walls sometimes have a hole that should not be there. It's not a door, it's a defect. So, for example, if the defect is in the atrium, we call it the atrial septal defect. If it's in the ventricle, we call it ventricular septal defect, and you can actually hear it using a stethoscope. All right, and uh, when we do hear a heart sound, we call it a murmur. So atrium is a part of the heart that receives blood. Atrium, chambers of the heart. Now, if the left atrium, which is the posterior most part of the heart, right in front of the esophagus, enlarge it, it can actually compress the esophagus and cause problems with swallowing. The term for that is dysphagia. Know this term, you'll need it along your, even in your pathology classes, but also in your core. Dysphagia means difficulty eating. So do know that the esophagus, just a reminder, you should know it. Esophagus, you already had gastro. Esophagus is the food pipe that runs directly behind the um, left atrium. So the ventricles are the part of the heart that actually contract and eject the blood from the heart chamber where the wall is the thickest is obviously the left ventricle because it works the hardest and empties its blood into the aorta. And remember that it empties anything that empties into aorta from the ventricle. What else would you call it other than aortic valve? Now, let me quickly summarize the vascular part of the cardiovascular. Uh, you do need to know that the artery is a blood vessel that leaves the heart, goes away, artery away from the heart. The biggest artery in the body is called aorta, and it delivers oxygen and nutrients to all the rest of the body, and obviously the cells of the body eventually via the capillaries. So the coronary artery supplies the blood to the heart. Heart has blood vessels that actually supply blood to the muscles of the heart, the myocardium, the pericardium. They all are made up of cells and do require food and oxygen, just like any other cells. If we were to obstruct the blood flow, for example, via a thrombus, blood flow, if the blood flow to the heart were obstructed, a patient might have a heart attack, which is colloquially known as heart attack, but you want to remember that the full term for that, the clinical term for that is myocardial infarction, or MI. Most of you obviously know it already. So what is the most common cause of the myocardial infarction? And some of you will be doing a project on that in pathology maybe. It's ruptured atherosclerotic plaque, and I'll go over details how that happens. Just remember the term athero. Athero is like a porridge-like structure. Sclerosis, the hardening, buildup of plaque. Lipids, cholesterol is a kind of a lipid, but also calcium and fibrous, but also cellular material, thread-like material, but also cells in arterial walls. This is a material that shouldn't be there, so it adds to the thickness and the walls become thicker, but it also hardens. Calcium, think of a chalk-like substance. Calcium, it causes the hardening of the blood vessels, and hardening in Greek, the word for that is sclerosis. So arteries harden and become sclerotic. So inadequate blood flow to the muscles of the heart, we get an infarction, the myocardial infarction. It doesn't have to be the heart only. It can be any other part of the body, such as brain, anything else. All right, so when a thrombus or a plaque builds up and blocks an artery, we're talking about an artery, that's when it happens, okay? Remember the term plaque. Plaque is a fatty deposit, and we said those fatty deposits are made up of cholesterol and other lipids. And remember that the right coronary artery brings blood and nutrients to the SA node. This is a review. I mentioned it earlier, but also the AV node. And so if there is an infarction to the right coronary artery, patient might have what? Bradycardia, slower heart rate, Brady, Tom Brady. So pulmonary trunk, pulmo means lung, trunk. Trunks are kind of larger arteries that come off the aorta, for example, and um, divide into large artery. The pulmonary trunk carries deoxygenated blood vessel, and that simply means that its oxygen content is lower, and it goes from the right ventricle to the lungs. Pulmonary. Anything pulmonary, artery, or vein has something to do with the lungs. So the pulmonary vein, and you know the veins return blood to the heart, right? So in this case, this is the only case where veins return oxygenated blood. Oxygenated means high content of oxygen is very high, and the pulmonary veins come back to the left atrium of the heart. So remember that the pulmonary vein has the highest oxygenation content of all the blood vessels. And as unusual as it is that a vein brings oxygenated blood to the heart, that's exactly what happens. Okay, so it's an oxygenated blood coming back to the heart, the left atrium, from the lungs. And remember, it's the pulmonary veins versus pulmonary arteries. Where's that? Pulmonary veins versus pulmonary trunk that divides into pulmonary arteries. Okay? The naming of blood vessels. If an artery goes to the kidney, we probably call it renal. If it's coming away from the kidney, we probably call it renal. Obviously, a blood vessel going away from the heart, it's a renal artery. Blood vessel coming to the heart, it's a renal vein. Same, so kidney right here. Okay, so you got to also know that brachiocephalic trunk, brachio means arm, cephalon is the head. Very easy to remember, head versus brachium, arm. Where do you think it's going if not to the head and to the arm? And why is it important? It's the very first branch of the aorta. If you were to exclude the branches that actually feed the heart itself, the coronary arteries, right? The coronary arteries. All right, so do know that the right side of the heart has deoxygenated blood in general, because most of the blood, all of the blood that's entering the right side of the heart is returning from the rest of the body, and left side of the heart, as we saw with the left atrium, it starts with the left atrium, has highly oxygenated blood just coming back from the lungs where it just got refreshed. So do know that the three veins empty into the right atrium. Superior vena cava, inferior vena cava, and the third one, often forgotten, is the coronary sinus, which is a vein that collects all of the deoxygenated blood from the heart itself, the myocardium of the heart, and dumps it back into the right atrium. That blood needs to be refreshed too. Superior vena cava collects all the blood from above, and inferior vena cava collects all the blood from below the diaphragm. Okay, so heart sits on the diaphragm, above is superior, below is inferior. Remember that there is a very special case where nutrients from the intestines, and I'm sure you've done it in your classes, in your gastrointestinal anatomy, blood vessels coming from the liver join together and form a large vein called a hepatic portal vein, which is a part of the hepatic portal system. And what happens in the liver is that ammonia gets processed, and then this clean blood, after liver is finished processing essentially the dirt, gets dumped into the inferior vena cava and goes back to the heart. So pulmonary artery, I've already mentioned it. It has deoxygenated blood from the right ventricle of the heart and takes it to the lungs, pulmonary, right? Pulmonary means lungs. You do need to know that uh, pulmonary vein, please just never forget that the pulmonary vein, because it's the blood vessel that just left the lungs, has the very highest oxygen concentration of all the blood vessels. It's just should be your second. It's a common sense thing, all right. And remember, the pulmonary vein returns to the left atrium of the heart. Just know the valve names. Atrioventricular valve between the right atrium and the right ventricle is known as right. It's always right, tricuspid. It's on the right side. Okay. The atrioventricular valve between the left atrium and the left ventricle is known as the mitral valve for you, and I'll show you in class why bicuspid is an anatomical name that you should use very carefully. You do need to know that the valves are controlled by thread-like structures called cord, full forms chordae tendineae, and these cords connect the cusps of the valve leaflets to the papillary muscles of the myocardium. And you can best remember it when you think of sails and the ropes on a ship or boat.